eager to learn. So mental illness advances in mental illness care, general teaching strategies, you have to convey the information in a non-threatening manner, use a straightforward didactic approach, use various teaching methods to reinforce information and hold learners' attention, and use humor. Of course, yung humor naman na nakakapagpatawa mo naman yung grilling or might be double meaning or it could offend the person or their family. Provide the frequent break times, practice skills in an informal manner. Of course, pagka may mental illness ng isang tao, hindi tayo pwede masyado maging formal. No, we have to ensure that this person will learn no matter what. Okay, okay, so physical disabilities is spinal cord injury. And of course, most frequently in adolescent and young adult males. Bakit? Kasi ito yung active or mga hyper or mga uh, adolescent na nag-explore and they love extreme sports or extreme stuff, no? Mga thrill seeker and very adventurous. Okay. Advanced technologies have increased survival and quality of life. Interventions are driven by the goal of independent living. So ito, spinal cord injury, I have handled several patients with spinal cord injury in the ICU. So sila yung talaga mga totally pwedeng maging bantang gulay. So, paano nangyayari? They become bedridden, they are able to move their extremities, both upper and lower, because of the severity of the injury that they have sustained or that they have acquired. Okay, obstacles to learning readiness, denial, lack of physical endurance, role changes of patient and caregivers, feelings of isolation, and general teaching strategies use group teaching approach, involve immediate caregiver, invite rehabilitated patients to share experiences. So, mga obstacles to learning readiness, denial. Of course, they cannot easily accept what happened to them, physically and mentally. Lack of physical endurance kasi mahina yung katawan nila, nag-a-adjust pa yan and they're still trying to adapt. And role changes of patient and caregivers. You know, some might be still wondering if they can still go back to their previous status. Pagka kasi mga spinal cord injury yan, tendency yan it could last a lifetime o hindi na sila makabalik dun sa normal functioning nila. So feelings of frustration, isolation, and they don't want to get involved or they don't want to communicate with people anymore because they are having a hard time accepting what happened to them. Okay, general teaching strategies pa rin natin. Group teaching, of course, kasama palagi dapat yung family ng pasyente, especially yung mga mag-aalaga dun sa pasyente. So, brain injury, trauma causes changes in behavior, personality, and or cognitive ability. It occurs most frequently in adolescent and young adults. Okay, because of the accidents, sa mga kung ano pinagagawa ng mga sports. And cognitive deficits may include poor attention span, slower processing, confusion, loss of memory, distractibility, impulsiveness, difficulty with problem solving. General teaching strategies for this, of course, conduct a family group sessions, focus on client safety and family coping, give step-by-step instructions, allow time for responses, provide small amounts of information, keep sessions short, and be very specific of what you want to teach them. Okay? So, communication disorders deficits affect perceptual and or language abilities. Most common residual communication deficits, you have expressive aphasia, receptive aphasia, dysarthria, and laryngectomy. So, ano nga ba yung aphasia? So, pag sinabi ng aphasia, this is something to do with the loss of speech of the patient. Expressive, ano yung pinagkaiba ng expressive sa receptive? So, expressive aphasia is when you know what you want to say but you have trouble saying or writing your thoughts. Receptive aphasia, on the other hand, affects your ability to read and understand the speech. You can hear what people say or see words on a page, but you have trouble making sense of what they mean. Okay. So, ano naman yung dysarthria? So, When you say dysarthria, this this occurs when the muscles you use for speech are weak or you have difficulty of controlling them. Dysarthria often causes slurred or slow speech that can be difficult to understand. Nabubulol. Yep. Of course, pagka sinabing so pagka laryngectomy, of course, maapektuhan yung voice natin or yung voice box natin. Na, laryngectomy is a surgery procedure to remove part or all of the larynx of or the voice box. So pagka nangyari yun, hindi na makapagsalita yung tao. Okay, so general teaching strategies for clients with aphasia encourage increased participation, acknowledge clients' frustrations, keep distractions to a minimum, speak slowly using a normal tone in short sentences, have only one person speak at a time. Huwag sabay-sabay. No? Kahit normal naman kayo, nakapagsalita kayo, kung sabay-sabay naman yung mga nagsasalita sa paligid niyo, mabubuisit din naman kayo. Tsaka mahirapan kayong maintindihan yung sinasabi. Stand where the client can see your face and check to be sure each message is understood. Allow each person time to respond. So for the starting, ensure a quiet environment. Encourage concentration and intention to improve speech clarity. Ask questions that need only short replies. Use alternative methods of communication. Encourage client to speak slower and louder. Do not simplify message because the client's comprehension is not affected. Again, ang naapektuhan lang dito yung speech ability or yung kakayahan ng tao na magsalita. So, we are asking them to speak slower and louder for us to be able to understand it. Na, wala namang kinalaman dito yung brain functioning ng tao or ng pasyente or ng client natin in regards with how they want to uh, express themselves or understand what they are saying, what they are saying to us or what we are saying to them. So provide a quiet environment. Watch clients' lips for clues to articulation of message. No? Lalo pagka walang papel, para kayo nagsha-charades dito. Pag walang papel at ballpen. And do not simplify the message because again, the client's comprehension is not affected, but their speech or their ability to speak is the only thing that is affected. If client's speech is not understood, repeat what you think was said and ask for clarification. Okay, it's just like um, reading back the doctor's order that was given through a telephone call or a cell phone call. If client's speech is not understood, repeat what you think was said and ask for clarification. Use alternative methods of communication. Okay. If meron kayong magagamit doon, like pencil and pen, pencil and paper, make them write para hindi kayo mahirapan makapag-communicate sa kanila. So, chronic illness is permanent, affects every aspect of life, physical, social, psychological, economic, and spiritual. Successful management is a lifelong process. Development of good learning skills is a matter of survival. The learning process must begin with onset of the illness, and often there is conflict between feelings of dependence and need for independence. So, general teaching strategies acknowledge loss or change in roles, recognize effects of illness on self-esteem, emphasize regimens that match physical strength, individualize instruction relevant to problems encountered, encourage integration of new knowledge for problem solving. So basta-basta mag-delegate, wag ilihis. Lalo na kung yung pasyente naman is or yung client naman is nagpapakita ng interest na matuto. Okay. Okay. And please avoid telling the client or something that would discourage them. And wag basta-basta magbitaw ng mga salita no, na oh, ganyan lang naman yung buti nga nabuhay ka pa. It is kind of insensitive for you to say that kind of thing. Though the person may be lucky that he or she is still alive. But the level of frustration if they have physical limitations and they are not used to it would sound very insensitive and offending. So, impact of chronic illness for disability on or disability in or on family. family roles and family role adjustments, family participation in teaching and learning. Na lalo na kung ang ah, yung nagkaroon ng illness or disability sa family is the breadwinner or isa sa mga inaasahan nila na makatulong sa kanila sa pang-araw-araw nila. Okay. So assistive technologies refers to the professional services and the hardware and software that make computer technology accessible to persons with disabilities. And impact on lives of disabled persons has liberated people with disabilities from social isolation and feelings of helplessness, enables independence leading to increase in feelings of self-worth, useful tool for health promotion. So malaki yung mga naitutulong mga technology or teknolohiya na meron tayo ngayon, particularly mga hearing aid and other surgical procedures that may be done in the hospital for the aid of those people who have illness or congenital defects that will help them to learn and to be educated and to work in society to help their families as well. So malaking bagay yan. So, benefits of persons with almost any type of disability. Advocacy role of nurses recommend the clients use computer technology and assist in obtaining appropriate equipment and training. Barriers to computer access, types of technologies available, pagkasama ng barriers of computer access, of course, yung mga kaalaman din naman ng tao in regards with the computer. We have to give an ample time to teach for them to be able to learn. And types of technologies na meron tayo, marami. Diba? Mga cellphone, may mga communication devices natin, computers that may help to visualize the inside the body or inside the body of the patient or the client that may need surgery or surgical procedure. So in summary, a disability has a tremendous impact on the lives of clients and their families. And successful habitation or rehabilitation means acquiring and applying new knowledge and skills that may help the client and his or her family. A nurse as educator needs to be well prepared to help clients learn to live independently. So kaya importante sa atin na pag-aralan natin yung yung disease ng pasyente or the case of the patient and what really happened to them and how can we help them as a nurse or as a healthcare provider. So that's all. Thank you for listening.